What are the proven benefits of breastfeeding? Our health advice: we no longer count the virtues attributed to breastfeeding. Are the benefits of breastfeeding so exceptional for the child? We take stock of what the science say. This is one of the major choices that a couple, and a fortiori, the woman, must make during pregnancy, whether or not to breastfeed her child. In France, exclusive breastfeeding is recommended at least until the age of 4 months, and if possible until 6 months. However, only 1 in 2 women breastfeeds 1 month after birth and 1 in 4 6 months later, according to the most recent data. However, and quote, scientific research proves the undeniable superiority of breastfeeding and quote, underlines a joint document from the Ministry of Health and the French Society of Pediatrics. Are the benefits of breastfeeding so exceptional for the child? For the mother? Figaro has taken stock with a pediatrician specializing in the issue to help you make an informed choice. What does breast milk contain? It and #X27. S not a miracle elixir, but almost. Breast milk has all the nutritional qualities to fully meet the needs of the infant. It contains proteins, lipids, carbohydrates and minerals in sufficient quantity. There are also many protective factors against infections, immunoglobulins, immune cells, as well as certain substances that help with digestion and the absorption of nutrient. And quote, the composition of breast milk is constantly changing according to the age of the child and the time of breastfeeding to adapt to his needs in quote, explains Pr. Dominique Turk, pediatrician at the Lille University Hospital. We can talk about a la carte food, while the composition of artificial milk does not change. What are the differences with artificial milk? That and #X27. S not the only difference. First, breast milk contains much less protein than industrial milk, but this quantity remains perfectly adapted to the needs of infant. In addition, it will decrease further as the days go by to make room for more lipids and sugar. That and #X27. S not al. And quote, breast milk contains long-chain polyunsaturated fatty acids, which play an important role in the development of the brain and retina, as well as oligosaccharides, these sugars which help prevent infections and quote, adds Professor Turk. According to the doctor, at least one industrial milk brand has marketed a product enriched with oligosaccharides, but according to him, and quote, there is no certainty that they have the same action as those found in breast milk and quote. What are the benefits for the child? And quote, it is certain that it is better to feed your child with breast milk than with artificial milk, but the benefits will obviously be greater in countries in economic difficulty, where the care channels are not efficient and quote, specifies Professor Turk. Currently, there is scientific consensus that breastfeeding plays a role in preventing infections. Studies show that, regardless of the socio-economic level of their country, breastfed babies are less likely to have acute diarrhea, infections and to be hospitalized for respiratory infections in their first months, indicates the pediatrician. The other benefits attributed to breastfeeding are further discussed. To establish a causal link between breast milk and child health benefits, a group of infants would have to be randomly assigned to one or the other of these feeding patterns, which is obviously impossible for ethical reasons, explains the doctor. Clearly, it will never be possible to obtain indisputable results, which explains the frequency with which studies with contradictory results appear. We can only speak of an association because the studies we have a low level of evidence, insists Professor Turk Agay. For now, many studies conclude that breastfeeding has a protective role against obesity. There is a reduction in risk of around 10 to 15% during childhood and adolescence. And the longer the breastfeeding, the greater the effect, says the doctor. On the other hand, there is no firm evidence that breastfeeding reduces the risk of diabetes, cardiovascular disease and allergy, or that it improves cognitive development. And for the mother? Women who exclusively breastfeed until 6 months of age also benefit. Early breastfeeding, for example, allows the uterus to regain its normal shape more quickly, via the secretion of a hormone, oxytocin, and prevents postpartum hemorrhage and endometritis, infection of the uterine lining. Breastfeeding also has an impact on weight loss since it increases energy expenditure. Another advantage: breastfeeding limits the return to be a kind of natural contraception, which is called the lactating amenorrhea method, LAM. However, this contraceptive method is far from being 100% reliable, even if the periods are absent. To increase its effectiveness, it is necessary to respect an interval of 6 hours maximum between each feed, even at night. This ensures that the level of the hormone prolactin remains high, which prevents the resumption of ovarian activity. Finally, breastfeeding would reduce the risk of osteoporosis at menopause as well as the risk of developing breast or ovarian cancer. But there again, it is only a question of association. The link has not been formally proved.